Welcome to First Sessions That Matter, how to deliver clarity, care, and connection, even in intake-only visits. Our access model prioritizes quick access and flexible appointments, including intake-only sessions. This expands access to care, but requires a clinical standard of care, consistency, and clear communication. We aim to provide a real clinical experience while setting clear expectations. The intake session is a clinical intervention, not just information gathering. The client should leave with clarity, direction, and hope. Set the tone early that this is already therapy. When intake sessions are purely administrative, clients may feel dissatisfied and question the value, leading them to choose not to return. This flow shows why the clinical experience matters, even in the first session. Clinically meaningful intake sessions are the first therapeutic intervention, driving client retention and providing continuous value. The intake is the start of the therapeutic journey, building trust and fostering long-term engagement. Set scheduling expectations early. Clarify the session type and ongoing availability upfront. Gather preferences for the handoff and handle these topics at the start to prevent confusion and disappointment later. Ensure a smooth transition to the next clinician by presenting the move as a deliberate step. Emphasize ongoing support and frame it as a collaborative, team-based strategy. Introduce the CBT approach by briefly explaining cognitive behavioral therapy and exposure response prevention. Emphasize retraining the brain to forge new, healthy neural pathways. Maintain a simple, confidence-building tone. Share a simple CBT formulation, showing how a trigger leads to thoughts, then feelings, and finally behaviors like avoidance. This grants short-term relief, but keeps the cycle going long-term. Practice CBT in action by reviewing a recent anxiety moment. Discuss the trigger, thoughts, body sensations, behaviors, and consequences. This anchors CBT in a real example. We use measurement-based care. You will receive brief symptom measures to complete in the patient portal before your next session. This tracks progress, guides decisions, and keeps therapy focused and results-driven. At your next appointment, we will co-create your treatment plan, identify goals, and set clear, measurable SMART goals. We will review progress regularly and formally review the plan every 4 months.